All right, hello friends. Good morning, good afternoon, and good evening, depending on wherever you're watching me from. I'm so sorry, I'm a few minutes behind time. All right, I'm so sorry about that. So today we are going to be looking at perimenopause, pain management, and then the strategies for managing this migraine that comes with perimenopause, joint pains that comes with perimenopause, and other chronic pain conditions that can come with perimenopause. Now, there are so many women that are experiencing these perimenopause symptoms and they don't really know. They don't know. Some women experience joint pains, body pains, sleep disorder. They find it difficult to sleep. Some women experience irregular period, mood swing. There are so many things that comes with this perimenopause transition. Now, like I said in my previous videos, perimenopause is that years leading to menopause, all right? Is that years leading to menopause? Is that years where you notice a lot of changes in your system? You notice fluctuations concerning your period, you notice migraine, headache that you cannot even explain, you notice joint pains, muscle pains, you notice so many things that you can't even explain. Now, to some people, I've had calls where people tell me, oh, that in fact they were binding and casting. That's why I always tell people, please share my videos. Whenever you come up across my videos, share these videos because it goes a long way to create awareness in so many people that are not aware of the situation. You might be aware of it, but when you share this video, it will not cost you anything to just share it, all right? People will benefit from it. So today, like I said, we are going to be looking at perimenopause and pain management. Now, and the strategies for managing migraines, joint pains, and other chronic pain conditions that comes with this transition period. All right. If you have been following me, you know that I've been talking about perimenopause and each of the symptoms, and then how it relates to our day-to-day activities. Okay, so another thing you need to take note is that we have what we call menopausal arthritis. Now, this is arthritis pains, joint pains that comes as a result of these symptoms too, this transition period. So once again, if you're online with me, if you're watching me live, please just say hello and don't forget to let us know where you are watching from so that we can specially welcome you. Now, perimenopause can come with a lot of physical symptoms. It comes with various symptoms, and some of these include chronic joint pains. Let's see who is online so that we can specially greet. Some of it comes with chronic joint pains. You see people crying with the pains that they are experiencing. I think my network, I don't know, is it my network or about my network or my phone? I think something just happened now. So perimenopause, let me quickly see what's happening. Let me quickly see what's happening. Perimenopause, sorry, please just give me a second. Let me see what's happening. Let me confirm what's happening to my. Is it okay? Eh? Okay, let me see what's happening. Just give me some minutes. Let's see what's happening to it. We forgot to. Okay, Madam Helen Jimo. Thank you for joining me. I'm so sorry. I had to stand up to see what is happening to my network. All right. So, Madam Helen Jimo, thank you so much for joining me. I can see you online. Where are you watching from, please? Please don't forget to share, share, share. Share the network, share it. Sorry, share the link, share the link, share the link. All right, so like I said earlier, we have what we call um Okay, I think I've talked about that. We have what we call menopausal arthritis. Now, this is joint pains that it comes as a result of those pains that you're experiencing during perimenopause. And we have, what causes this again is as a result of a decline in the estrogen levels. We need this estrogen to help us for our bones. Now, when your estrogen levels is declining, then it can worsen your joint pains. It can worsen your joint pains. All right. So that's why it's very important that you take note of those little details. Take note of those little details that you experience or you see around your body, and it will help you a great deal. Perimenopause, like I said earlier, can bring about various physical symptoms, okay? And this can include chronic pain conditions like migraine. You notice so many people experiencing migraines, experiencing severe headache that they cannot even place their hand on and say, this is the cause of this severe headache that they are experiencing. And then some people experience joint pains, like I said earlier, and then muscle ache. You notice muscle ache. Now, this muscle ache too you just notice this muscle ache that can make you to scream, that can even make you to cry. Women experience that a lot. And then you notice hormonal fluctuations. This is as a result of the decline in the estrogen levels. Hormonal fluctuation, lifestyle changes, and then increased stress. You notice all these things, they can worsen the situation. So, but then what are the strategies? What are the ways that you can, if you're online, thank you so much for joining me. Thank you. Please drop where you're watching from so that we can as well appreciate you. Thank you so much for joining me if you're online. Madam Helen, I can see you. Thank you so much. All right. Now, when you notice things like this, you will know that because of that transition stage and because of that decline in estrogen levels, this can worsen the situation. For women having such um, um, symptoms or experiencing a decline in their estrogen levels, which can worsen the situation, then you can use our Vitalize for Women and the marker. Now, this Vitalize for Women and marker, this Vitalize for Women and the marker is very good. All right. So many women are using it and they are living their lives happily. Now, this Vitalize for Women can help to boost that estrogen levels that is declining, and it will give you back that vitality. It will give you back that confidence. Now, if you combine it with marker, it will also help you to correct hormonal imbalance issues. All right. So when you experience these things and you use this tool, it will help give you back that female vitality that you need. And once your estrogen level is normal, is not declining, is not fluctuating, those symptoms plus lifestyle changes, those symptoms will gradually go off. They will gradually go off. All right. Now, stress can also worsen it. Sorry, if you want to get this, I'll put my number on the screen. You can WhatsApp me on 08034005928. All right, and I'll tell you how to get it. Now, stress is another factor that can worsen the situation. And in this case, effective pain management is very, very crucial, very important for maintaining quality of life. All right, it's very, very important, very crucial for maintaining quality of life. All right, I'm trying to see who is online with me again. I think I don't know if my network is acting up, but let's just continue. I don't know if my network is acting up. Let me just continue. I believe my network is fine, it's just fluctuating. So now, how can you manage? Sorry, just just leave it. I don't know, I forgot to put the call on silence. All right. How can you manage how can you manage these migraines during perimenopause? How can you manage it during perimenopause? Now, one of it is that you need to avoid, or rather identify and avoid certain food that can trigger stress and lack of sleep. I've talked about the foods that you can avoid and food that you can eat. If you missed that video, just check my page, Healthy Aging with Annie, and you will see it. Now, there are some foods that can trigger or worsen the symptoms, and you need to avoid it. For example, excessive alcohol, spicy food, coffee, all right, then pasta. You need to go for whole grain foods. You need to go for more fruits and vegetables. You need to go for foods that contains omega-3 fatty acid like salmon fish, tuna fish, mackerel fish, sardine fish. You need to go for fruits that can help you. Avocado also contains omega-3 fatty acid. Then healthy nuts that is good for the heart. Like for me, I don't miss my Arctic sea. Now, this Arctic sea contains omega-3 fatty acid and is good for inflammation, is good for the cardiovascular health, is also good for your brain, for your nerves, and it's also good for these perimenopause symptoms. Now, you don't need to wait until when the symptoms start coming before you start facing it, attacking it. Prevention, they say, is cheaper, safer, and better than cure. So you can start early by doing these lifestyle changes. And what do I mean by doing these lifestyle changes? I mean avoiding those food that can trigger the symptoms, doing exercises, be active, eat foods that can help to alleviate the symptoms, to reduce those symptoms. Those are lifestyle changes, and it will help you a great deal. And even when you enter that period, that transition stage, you might not really feel the symptoms as much as that. I don't know who is calling me now. Somebody is calling me. Please press the red one to cut it. All right, I forgot to put my phone on silence. I forgot to put my phone on silence, and it's affecting. The call is just disturbing. I'm sorry about that, and I can't do that now. The next one that you need, after identifying and avoiding those triggers, all right, those foods that can trigger the symptoms, stress and lack of sleep, it will help you a great deal. Another thing again you need to practice is you need to practice relaxation techniques. Now, for example, you can do a deep breathing. It helps. And then meditate. You can also do yoga. It also helps. All right, yoga exercises also help in relaxation techniques. It's one of the relaxation techniques that you can add to your lifestyle changes. It's very, very good. Then the next one again is that you need to consider certain supplements. There are some supplements that you can add to your diet that will help you. Supplements that contains magnesium and vitamins and B vitamins, iron, all right, calcium. And this might vitalize for women. That's why I say you don't need to wait. Prevention, they say, is cheaper, better, and safer than cure. Vitalize for women. This vitalize for women contains vitamin C, vitamin D, it contains vitamin E, it contains the B vitamins, it contains calcium, it contains iron, magnesium, it contains a whole lot, and you need all this because aging too can make you to lose some nutrients. So you need all this to help you. That is why adding these supplements to your diet plus your lifestyle changes will go a long way to help you. Then the next one is that you can also meet with your doctor. All right, you can meet with him when you notice some of these symptoms that you cannot bear it, that is affecting your lifestyle seriously. You can meet with your doctor. But if you notice that, oh, it's just coming up and you're like, okay, how can you go about managing it? Fine, you can give me a call or you chat me up on 080 34 005928. All right. Then the next one again is that you need to stay hydrated. You need to stay hydrated and maintain a consistent sleep schedule. Now, for some of us might work late into the night. Some of us, we already have a sleep schedule. That is, once is 9 p.m., some once is 10 p.m., some once is maybe 10:30 or 11 p.m. Though it's not so good to stay that late, but you have that time that you have fine tune your body to that point where once is that time of your sleep, you will start dozing off no matter what, which is good. So you, and once the sleep is coming, please drop everything you're doing and just sleep. Sleep is very, very good and very, very important. All right, so try to stay hydrated. Again, try as best as possible to drink water. Drinking water during the day, drink lots of water during the day, and reduce your intake of water at night so that it will not disturb your sleep. It can make you to be standing and going to use the restroom. All right, so drink less water during during in the night, but drink more water during the day, and try as best as possible to drink at least 9 or 8 to 10 glass cups of water, or even 12 on a daily basis. But avoid late night water so that it will not disturb your sleep. So try to stay hydrated is very, very key, very, very important. All right, so let's look at how you can manage the joint pains during perimenopause. One of it is that you need to engage in regular exercise like swimming, yoga, or you need to try, it will help you to maintain. And then some exercises that you can do, there are some strength training exercises that you can do. It will help you to maintain joint mobility. All right, it's very, very good. Then the next one is that you need to practice stress reducing techniques. Find a way to reduce your stress. All right, reduce your stress is very, very important. Then the third one is that you can also consider physical therapy. All right, you can meet with your doctor and they can advise you on that. Then the last but not the least for managing the stress is that you need to maintain a healthy weight to reduce joint pressure. Now that is very, very important. Maintaining a healthy weight is very, very important because it will help you to reduce joint pressure. Now when you have too much weight, you are putting enough pressure, too much pressure on your joint. But once you reduce your weight, you will notice that that pressure is no longer there. Now, for people that are experiencing menopausal arthritis, all right, you can use these two, the Vitalize for Women and the Forever Move. For people experiencing menopausal arthritis, and you can as well use this heat lotion. These three together will help you a great deal. All right, so if you also want to know how to get it, like I said, WhatsApp me on 08034005928. Okay, then managing other chronic pain conditions during perimenopause, you still engage in exercises. All right, exercises, engage in exercises, meet with your doctor, maintain a healthy lifestyle. It will help you a great deal. Now there are some people that experience osteoarthritis. You need to engage in regular exercises. For the osteoarthritis, you can use this Forever Move, and then you can add this because of the symptoms of perimenopause. All right, that is increasing or worsening the joint pains. Okay, so osteoarthritis is something that you can engage in regular exercises, and then also practice joint protection techniques. All right, you can register in a gym, you can do your gym work from your house. Okay, so general pain management strategies, how can you go about this? The same thing, prioritize stress management and relaxation techniques. You need to relax, it's very, very important. Engage in regular exercises and maintain a healthy lifestyle. Okay, maintain a healthy lifestyle. I'm trying to see who is online. If you're online, just say hello. Thank you so much for joining me. Thank you. And please don't forget to share this video. Don't forget to share it so that it can create awareness in women. Engage in regular exercises and maintain a healthy lifestyle is very, very important. All right. And then stay connected with your doctor. And you can also join a support group where they talk about this. There's an enlightenment about it, and you know how to go about it. So you just need to remember that perimenopause can bring unique pain management challenges. Just bear that at the back of your mind. Now, effective pain management requires a it requires an approach that will help you to take care of the situation. Then prioritize self-care, love yourself, and know that you're not in this alone, okay? It has to do with aging. And then stay informed and seek support to maintain quality of life. All right, so bear all this at the back of your mind. Pick the best, put it together, and practice it. It will help you a great deal. You just need to understand the impact of perimenopause on chronic pain conditions, and then implement effective pain management strategies. All right, and this will help you to reduce the symptoms and improve overall well-being. So try and practice these lifestyle changes, and you'll be glad you did. Once again, this is Healthy Aging with Annie, and if today is your first time of joining me or coming across my video or joining me live, you're welcome to today's live show. And for those of you that are watching the recorded version, you're also welcome. Please, if you want to get across to me, you can WhatsApp me on 08034005928, and I'll tell you how you can get this product. All right, and if you just want to have a chat with us, you can still use the number on your screen. Don't forget to share this video. Don't forget to follow us on all our social media handles: TikTok, Facebook, YouTube, and Instagram. Healthy Aging with Annie. Thank you very much, and see you again in my next video. Bye.